We're live.
Fantastic. Thank you. Good morning, friends. Thank you, as always, for taking time out of your busy schedules for us to get together and talk about these really important topics. Really incredibly excited here in Anne Arundel County Public Schools and across the state that we're back to full in-person learning. Our Y has returned to our buildings. We're incredibly excited to have the students back. It's not been easy, and it will continue to be difficult, I'm sure, into the near future. But I appreciate everything that you are doing, everything that all of our educators and support folks are doing across the state to work with us to keep our students safe and to keep them healthy and to keep them in school 5 days a week. It really is very, very exciting. So with that, Kate, if you'll walk us through a roll call so we can see that we have who's participating today and that we have a quorum.
Sheriff Adams. I didn't see him in here. Tom Albin.
Here.
Kelly Anderson.
Here.
Good morning. Dr. Arlotto, you are here. Karen Bailey. Karen, I thought I saw you.
She's here.
Good morning. James Bell.
Here.
Good morning. Megan Berger.
Good morning.
Good morning. Claire Cabral.
Here.
Good morning, Claire. Dr. Jody Coleman. Delegate Ebersol.
Here.
Excellent. Dave Engel. Director Engel. I'll see you. Pam Gaddy.
I'm here.
Good morning.
Good morning.
Captain Herring. Dr. Hoover. I think I just saw Captain Herring jump in. Chief Kiefer. No. Senator Klassemer.
Here.
Good morning.
Good morning.
Laurel Moody. Lee Oppenheim.
Good morning.
Good morning, Lee. Samantha, I believe you're here for Secretary Padilla.
Yes, ma'am, I am here.
Good morning.
Good morning.
Manfred Reek. Detective Smith.
I'm here, ma'am. Good morning.
Good morning and welcome. Nick Shockney.
Good morning.
Good morning. Scott Tiffin.
Good morning. I'm here.
Good morning. Andrew Tress. Okay. Dawn, is that a quorum?
This is Patrick.
Yeah.
I joined a little late, apologize, but I'm here.
I've got you, Captain Herring, and yes,
Thank
we have 15 voting members present. We have a quorum.
Wonderful. Thank you very much. Thank you, Kate, and thank you, Dawn. The agenda went out towards the end of last week. Do we have, I know you've had a chance to take a look at the agenda. Do we have any additions or suggested changes to today's agenda? I am going to now and throughout the meeting try and keep an eye on the participant list. So if you do have questions, please use the raised hand function, and I'll look for that so that I can appropriately call on individuals that want to be recognized. Seeing no hands regarding the agenda, can I get a motion to accept the agenda as printed?
This is Samantha Blizzard. I move that we accept the agenda as printed.
Thank you, Samantha. Is there a second?
Second, that was Tom.
Tom, thank you very much. Any discussion on that? Seeing no hands or hearing none, all those in favor of adopting today's agenda? Okay. We have an agenda and let's move forward, Kate. I know that we've got some new members and new appointments and a couple of folks that we talked about at our last meeting that were going to be leaving us. If you'd like to introduce our new members, that would be fabulous.
Sure. So hopefully you see the slide. Those highlighted are your new members to the board. I'm hoping that they'll take a minute, introduce themselves, let the group know who they are, where they're from, and their sort of the lens that they're looking at school safety through. So Claire, would you like to go first?
Sure. Hi, my name is Claire. I'm a sophomore from Baltimore County. I go to Hereford High School. I am appointed by the Maryland Association of Student Councils to serve on the advisory board. I am also the student facilitator liaison of the MTSS Student Focus Group, which is in its second year. I'm extremely excited to be working this year and to continue to advocate for school safety. The Student Focus Group has already started meeting and we're planning to meet monthly and to get some initiatives going. So I'm extremely excited to be here. Thank you so much for having me and I look forward to getting to know all of you.
Thank you, Claire. And Dr. Coleman is not here. Detective Smith?
Yes, ma'am. Good morning. Hello, everyone. I'm Detective Lawrence Smith. Been a school police officer for 20 years here in Baltimore City. I've been appointed to the advisory board by Masro. We're trying to get this thing started back with our Masro organization. So I'm looking forward to meeting everyone and working with everyone and do whatever I can do to help continue with school safety here in the state of Maryland.
Thank you. And Scott?
Hi, I'm Scott Tiffin here on behalf of MASBAC, the Maryland Assembly of School-Based Health Centers. So we work to support healthcare providers in all of our schools. And obviously, I think there's a lot of interplay with school safety and behavioral health. And so I'm really happy to work with all you guys.
Kate, can I just give a clarification to everyone since we have the whole membership list up here right now? So sometimes in our state laws and our state statutes, there's committees and boards where they allow a designee. This one is not. So if you are here representing anyone as their, in their place today, we thank you for being here. But only the individuals whose names are listed on this chart can vote. They are the voting members. So sometimes we have folks send someone else in their place if they're not able to attend, but they do not count towards quorum and they do not count and cannot vote. Okay, just wanted to make that clarification. Thank you.
Thank you, Dawn. A very important distinction. So thank you for reminding us all. Appreciate that. Okay, moving on to the agenda. Kate, we're going to talk a little bit about behavioral health service coordinators.
Yes. So before I introduce our guests who are going to be speaking today, there was a change. So back in 2018, when the Safe to Learn Act passed, there was each school system had to identify a mental health services coordinator. The blueprint for Maryland's Future actually updated that title. So they are now actually called, as of this year, behavioral health services coordinators, but they're doing the same thing. So it is my pleasure to introduce, we're going to have Robin start first. So Robin Schrader is with St. Mary's County Public Schools. So Robin, you can share your slides and then just kick me off.
Sounds good. Okay. First, yes. All right, let's see if I can do this correctly. Okay, hopefully everybody can see my screen. Thank you so much for inviting me to speak to you guys today about all the wonderful things that St. Mary's County Schools, what we're doing to help support our students with all the mental and behavioral things that are challenging us as we return to in-person instruction during COVID. So this is what our current system of supports look like. This is a general, very broad category of topics for them. We do a lot more than what's listed on this screen, but I wanted to try to give you guys a visual of how we're supporting our students. So currently in St. Mary's, we have the majority of our students are here in person in our brick and mortar buildings. We also opened this year a virtual academy for students that wanted to attend virtual school all year. So I listed out how we're supporting them through our multi-tiered system of support. And if you start at the bottom and look at our tier 1, that is, what are we doing for all of our students? What access are we doing to provide mental and behavioral health and wellness supports to our students? So, we're providing SEL instruction. You'll see that on both sides, on the virtual and the in-person side. We have mental health website, Google site for resource and information that is accessible to both groups of students. We have social emotional check-ins for students as needed on both sides of that instruction. Our counselors are providing counseling support for curriculum-based support in every single school, as well as all of our virtual students have access to a school counselor that is dedicated to our virtual school. For our tier 2 supports, we are providing in-person groups for concepts and topics like conflict resolution, depression, substance use, anxiety, coping skills. The majority of our groups are parent consent required. Those groups are happening in both the virtual world and the in-person instruction world. We also have like lunch buddy type groups, which are drop-in support groups where students can kind of pop in and just collaborate with each other and provide that emotional support to each other in a less structured environment. So we are providing both. And then our tier 3, which is our more one-on-one support, our intensive needs students, that 20% of the population at the top of that triangle. We are doing one-on-one counseling support for emergencies, and we'll go into a little bit of that in a minute, what that means. We are doing one-on-one counseling support for our 504 and IEP students, again, on both sides for in-person and virtual instruction. We're doing support for students by our school counselors and our school psychologists. They may see students for, a couple of sessions to help support their transition back into the school setting. We're seeing an increase in anxiety significantly in students. So there's a lot of those sessions happening for students. And then we also have our school social work team who we started employing about 2.5 to 3 years ago. We started that process, and they are doing something called ongoing counseling for a 12-week program. It's a referral-based program in our middle and high schools, and we are very excited to be starting to expand that down to our elementary schools here very soon, to engage students that need that more intensive work, but maybe not rising to the level of needing outpatient treatment. At the same time, because our outpatient mental health providers in our area are so overwhelmed as well, a lot of that need is bubbling back over into the school system, and we're where the kids are. So we have to serve them, and we have to do our best to support them until we can get them hooked up into the outpatient world. And so a lot of students are getting referred to that program, both in person and virtually. So we are servicing both sides of the house. So this is just a little list of some of the mental health and wellness resources that we have started or expanded since returning to school and since COVID started. We created mental health and wellness Google sites for elementary students, our secondary students, our parent guardians, as well as our staff. And I really wanted us to have a one-stop hub of resources. I find that there's a lot of great resources out there, but you have to search and hunt through websites and what's a reliable source and what's good information. And so we've kind of done that work for those groups. And I'll click on one of them just to give us an idea. So these links were placed in September. So you're going to see the mental health and wellness page listed as September when I click on this. So if you can look at that, this is just an example of the elementary site. So September's mental health topic was sadness and depression. And so we have a little Gizmo's guide to pause on mental health. And we created this entire site to provide what is mental health? What does that mean for the developmental age of an elementary student? So all the resources on this page are developmentally appropriate for elementary age. It's for the student. There's a feelings exploration Bitmoji room. They click on that, they can explore the emotions of happy or angry, etc. I'm not going to go through all of that for the sake of time today, but you can see that we incorporate a lot of different activities for students to do that are age appropriate to help them process all the emotions that they're feeling as they return to school. And it also helps them learn what to do and when to get help. So I'm not going to go through the whole page, but if you want to take a look at that, you can always click on that. I will send out the that. Go back to my all right. So if you click on each of these, it'll take you to those mental health and wellness pages. So that's one big thing that we did. On the staff mental health and wellness page, it's the same concept, except it's broken into two separate focuses. One is on the student. You know, what can you as a staff member do to support the mental health and wellness of the student? But we also wanted a place for our staff to go. What do they do if they're feeling overwhelmed, if they're feeling anxious or depressed, where to go for help and things to help support them? We are doing a mental health and wellness newsletter this month, is the start of that coming in October. We'll also focus on that mental health topic of the month. We're really trying to hone in and sort of pull all of our resources together for folks. We're providing training on that same mental health topic of the month to our administrators and supervisors. We're providing staff training around mental health, including QPR for crisis assessment, youth mental health first aid, incorporating training in our PD days for staff. We created a safety protocols page for teachers and staff. It's been a long time since we've had students physically in the building 5 days a week, and we did things differently during hybrid instruction. And so this is a one-place stop where teachers and staff can go to remind them, oh yeah, what do I do if a student is feeling suicidal and they're in virtual academy? What do I do? What do I do if that student is sitting in my classroom? Yes, they did that before, but everybody is so torn in a million directions. We wanted to have a one-stop shop so people could just go and get that information that's easily accessible. Our school health council site is also easily accessible. And we also created a mental health resources button on our main website. And we also have student dashboards in Schoology that link them to all of the mental health and wellness resources that the district has. So our mental health and wellness staffing, we are supported by school counselors, school psychologists, pupil personnel workers working with our families, our behavior specialists. We have our grant-funded school social work team. We do have some contracts with outpatient clinicians for about 5+ schools. Those are serving our our Medicaid and our state insurance students only, but it is an additional support that we have in our schools. We also have 2 school-based health centers that just opened. We are working towards making that more incorporating of mental health as well. We're not there yet, but we are working towards that. For St. Mary's, our community partnerships are what keep us together. We could not be doing this without the support of all the local agencies, state agencies, and companies that help us do what we're doing. We collaborate with our sheriff's department. We are working with the health department in regards to our behavioral health services, some grants. We work with GAGL, the American Federation for Suicide Prevention. It's just, for us, I don't feel that we could do what we do without these partnerships. So we really do that to help promote and support our students with mental health and wellness. Also in St. Mary's, we are very data-driven. Data is essential in the way that we look at everything, including mental health and wellness. Our MTSS school-based teams review their data, so their discipline data, their own mental health data. We have a district team that also reviews the school's data. We really narrow that down and then provide feedback to the schools on areas that we see patterns in or we see concerns in for students. We collect our risk assessment data. I'm sure this is consistent across the state, as well as probably across the country, that we are seeing a huge rise in the number of students reporting feeling suicidal or overwhelmed and participating in self-harming activities. I can't tell you how many we are doing right now. We have literally tripled the amount of risk assessments in the first month of school compared to the prior 3 years. So obviously that is a concern. We're trying to meet those needs, but it is very time consuming when you do risk assessments. They're getting it done, but we are doing a lot of them. We are looking at our data from bullying, our threat assessment data, our CPS data. It is clear from that data our families are struggling right now. And when families struggle, they lose sometimes their ability to discipline the same way they used to. When parents are stressed, things happen, and we're seeing a huge increase in that as well. And I think that's consistent with other districts in the state. And lastly, we look at our social work team intervention data, that 12-week mental health and behavioral health program that I talked about. We look at like 6 different areas for our students: anxiety, depression, coping skills, substance use, connection to school, and self-esteem. And we look at that pre and post assessment data for each of those kids in the program to see, are they getting the skills they need to improve that functioning in that area. So we collect all that data as well. Our struggles, I think every single school system in the entire country is on the struggle bus right now. I think we are doing an amazing job. Our teachers, our administrators, our upper administrators, our school board, every person is really putting in 100%, and probably more than that, really. And I think we're struggling sometimes to feel like it's enough. We're trying. We have staffing, there's teacher shortages. We always need more funding. People are exhausted and burnt out right now. So that's where we have that staff and student mental health needs are rising. And we're trying to meet that demand for that. There's increased demands in every single department in every single direction. The workload is immense for many, as it is for probably all of you right now. The increased complexity of needs within our families. I've been doing school social work, clinical social work for almost 25 years now. And I can without a doubt say that the simple problem solving that we used to do no longer exists. Each situation that our students are bringing to us, our families are bringing to us, are very complex. And it's taking a lot of partnerships with our community and within our school system to meet the needs of our families. We are doing it, but it is definitely a harder job than it used to be. And expectations. I think we rock as a school system. I've been in a different school system and that was good. But honestly, the support from the school board, upper administration, and all the way down to our teachers, everyone is doing so great, and they support the mental health and wellness of our students and our staff. The expectations that are out there, it feels very much like you can't always please everyone. We know that. But I think we're in a pretty difficult time right now, and we're doing great. I'm proud of all the things that our staff are doing, but I just wanted to highlight some of the struggles that we do have. I guess that's pretty much it. Does anyone have any questions for me?
Robin, thank you so much. This is George Arlotto. This is really great information. And if you're willing to share your slides with the group, I think that would be really beneficial. Really well done. I agree with you that St. Mary's rocks. There's no question about it. You all are doing some amazing things and have been leaders across the state in providing behavioral and mental health supports for students. So thank you for everything that your team is doing in St. Mary's. I would agree also that across the state, as I'm talking with my colleagues, the other superintendents, that we're all on the same struggle bus. This is a really, really difficult time to be bringing students, as we're bringing our students back into full in-person learning. It seems like so long ago, but so many of us were in the hybrid modality last spring, and at best, maybe 50% of our students were back in schools. And so having full buildings, having staff back in who may not have been working with a full classroom of in-person students is all adding to some of the difficulties of returning to school. If you don't mind, during your presentation, you used an acronym that maybe not everyone is familiar with, MTSS. Could you talk a little bit about those multifunctional teams and what they're doing in schools? I think that would be an important point for all of us to understand.
So MTSS is the multi-tiered system of support. It is basically a model of response to intervention. So if you look at any student concern, whether it's academic or behavioral or mental health, if you look at that triangle model that I showed you, 80% of your students function with that tier 1 level of support, right? The prevention services that you put into place, if you think of it like from an instructional standpoint, from academics, the way a teacher teaches, 80% of the students are going to learn with that general premise. You're going to have 20% that need something different. You might have that 15 in that tier 2 level that need a little additional instruction on how to do that equation. You pull them into groups, you do a little bit additional, and then you have that 5% all the way up at the top that the group work, the pullout isn't quite enough, but you need to do really highly focused intervention to support that student's need. Our MTSS teams take that model and apply that to instruction, to mental health and wellness, and to behavior for students across the board. So it is a model that is used across the country and across the state in supporting student needs.
Robin, thank you so much. Are there any questions for Robin? And I'm looking for hands. Or maybe comments regarding some of the information that she shared. Claire.
Hi, I have a quick question for you. All of the programs you mentioned were really cool to learn about, and I really appreciated that you have created those as a team. How are you promoting those to students within your county and staff?
Are you referring to the Google Sites and all of those things, Claire? Okay.
Yes.
Yes, just wanted to make sure. Yes, so we put them in our communications that go out to our staff, our communications that go out to our family, any of our collaborative community-based meetings that we have, like we have our partnership with the health department. There are community-based meetings where multiple agencies, including the school system, is a part of. We promote them there. We put them on our website. Our staff knows about them and supports them. We've hooked them into our Schoology platform where the students are. We actually have on the side now, when a student logs into Schoology, there is a link right there that talks about the mental health and wellness. When they click on that, it comes up to a dashboard and they can click on those individual things. Word of mouth. Our mental health staff, like our psychs, our social workers, our counselors, they're also using those Google sites as one-on-one intervention with our students. So like you can pull that up and go through that anxiety video with a student and then really work on those skills with a student to say, okay, what did you learn from that? How does anxiety impact you? And what can we do to help you overcome anxiety when it starts to bubble up for you? So it has a multifunctional use.
Thank you.
Anyone else? Okay. Thank you, Robin, very much. Kate?
All right. Cynthia? All right, so Cynthia's here from Howard County Public Schools. So Cynthia serves as Behavioral Health Services Coordinator in Howard County. And I see her slides, so you're good to go.
Great. Good morning, everybody, and thank you for the invitation to speak with you today. I suspect that a lot of what I'm going to share is going to sound very familiar. Certainly St. Mary's County and Howard County use many of the same structures when we're thinking about how we're supporting the mental health needs of our students. However, you know, the information is important enough that it bears worth repeating. So I hope you can bear with me as I work our way through what we've prepared for today. So in Howard County, our model for supporting mental health students and the mental health of all of our students, we believe that it's everybody's responsibility. So this is just a visual here that you see who's represented by that everybody. It starts with our classroom teachers on the upper left-hand corner of the picture. Certainly our school counselors, our alternative educators, school psychs, pupil personnel workers, and as you work your way all the way around, you see that there's many different components and many different contributions to supporting mental health of our students. Without having this picture in front of her, Robin did a great job describing everything that's on here. So we too utilize the multi-tier systems of support when we're thinking about how we're going to organize our services and supports that we're providing students. So like was just shared, we tend to start at the bottom when we're looking at things, and that's often referred to as tier 1 or universal interventions. And that's where that 80 to 90% of our students respond successfully to the interventions that are put in place for all students. You move up to tier 2, which is also referred to as the targeted interventions. And here we're looking at, you know, somewhere in the 5 to 10% of our range where we need to put additional interventions in place to target a specific skill or to target a small group of students. And then last but not least is the top tier, often referred to as individualized interventions. And of course, that's a smaller percentage of our students who need these individualized supports. And like Robin shared, this is a framework. And so a lot of what I'm going to be sharing in the next couple of slides is how Howard County uses this framework to organize the interventions that we're putting in place. Now I'm going to share with you that my organizational structure might be a little bit different than what Robin's has, but I think you'll see a lot of similarities across what it is that we are sharing when we're talking about how we're supporting the mental health needs of our students. But first, before we get into those interventions, I want to actually give you an intersection. So the one slide that I shared with you that had that everybody has a role in supporting mental health needs. And then, of course, we just briefly reminded ourselves of the 3-tiered structure, tier 1, tier 2, and tier 3. And what you see here is how these two intersect. So on the left-hand side are many of the different individuals as well as teams that we have working in our schools supporting students' mental health. And then, of course, we have tier 1, tier 2, tier 3 across the top. The list will look very familiar to the list that is shared for St. Mary's. We certainly have school counselors, school psychologists, our nurses and our health assistants, our pupil personnel workers, all the way to our different teams, our instructional intervention teams, student support teams, mental health community advisory council. I'll explain a little bit more about some of these as we work our way through the next couple slides. So for the purposes of our presentation today, I really just provided a sampling of some things, and this is where my organizational structure is just a little bit different. The top half of the slide are things that we've been doing for multiple years. The bottom half of the slide are some additional interventions that we put in place in the past 18 to 20 months. So kind of how we organized it for each of our tiers today. So when you see, we too, just like many other districts, have social emotional learning. We use a curriculum referred to as collaborative classrooms is the curriculum that we've chosen. This year, we've actually also started introducing it at the middle school level as well. So that's a new additional piece that we're very excited about. Like everybody across the state, we all provide an annual training of suicide prevention. This is to meet the requirements of the Lorenz Law. Also, like many of you across the state, we are engaging in positive behavior intervention and supports, as well as using restorative justice across all of our schools, and certainly implement health education and school counseling curricula across K-9 or K-12, depending on which program it is. In this time of COVID, we added some additional structures in place, and this is something that we refer to as re-entry social emotional behavior look-fors. This was a tool that we utilized across all of our schools, where we asked any staff person in the building, no matter your role, no matter what you were doing, to help us identify students that we are concerned about for a variety of reasons or might be experiencing hardships. We organized it into the 3 categories you see listed here: concerns related to COVID, classroom performance, and social emotional well-being. While this structure was primarily utilized during hybrid learning, we have fast forwarded and are continuing to use it during the current school year because we're finding that those 3 categories are still relevant to what our students are bringing to our school. Above that, very similar to a lot of what's happening in St. Mary's County, we have some additional resources on our website, and these are 2 links that will get you there. Again, organized a little bit differently, but many of the same types of materials, information for staff, information for parents, information for students can all be found on our website. Now, before I leave this slide, we were also asked to identify what are some challenges that we're experiencing. So I'm going to do that at each level. So some challenges that we're finding at the universal interventions level is identifying students who need to go to tier 2 or tier 3 and figuring out a consistent way to identify those students. So is that something we're going to do through our re-entry look-fors that we talk about here? Or is that something that we're going to do through a more of a universal mental health screening approach, as is outlined in House Bill 1300 as part of the blueprint? So that's something that we have to improve upon, and certainly has been a challenge for us over the years. The other thing that we have found, and I'm sure this has happened in your districts too, a lot of the interventions that we've put in place that are school-wide all happened at different times. For instance, positive behavior intervention and support, some of you have probably been doing that since 2006, 2007, whereas you might be doing restorative justice, that might have been part of your work for the past 4 or 5 years. Certainly social emotional learning for some districts started more recently, whereas other districts have been doing that for a long time. So another challenge is just trying to help staff understand how all of these initiatives fit together and how they all serve a purpose. And we don't want people to feel like they're having to do 4 and 5 different things. We want staff to see how they're aligned and how they all support the mental health needs of all of our students. So that's certainly a challenge that we are experiencing, and I'm guessing that probably is true for you as well. Now, if we go up the triangle and we think about those targeted interventions, some things that we've listed here were actually not only relevant during the prior to the pandemic, but also during the pandemic. So certainly we have our in-school alternative education program. We have that in 30 of our schools. Schools intervene using check-in, check-out types of programs. We have our student support teams, which I know is a phenomenon across the entire state, but we also have our instructional intervention teams as well to support academic needs. We may have class-wide interventions that address executive functioning skills, organization, task initiation, sustained attention. And I'm not sure what your experiences have been so far now that we've all been back for about a month of school. We're finding that these class-wide interventions are probably needed in every single classroom, in every single school, in every single building. This is probably an example of one of those things that we didn't use as much when we were in virtual learning, and now having to re-engage with that. So that certainly is an area of focus for us. Certainly small group counseling to support with topics such as coping strategies, self-management strategies, socialization skills. And if you go back to that grid a few slides before, individuals who participate and support small group counseling are many. It's our school counselors, it's our school psychologists, it's our school social workers. So all of them are available to support in small group counseling. Now, when I'm thinking about challenges at the targeted intervention level, I'm going to share some challenges that definitely existed pre-pandemic. So this is not exclusive to just the pandemic, but certainly consistent implementation of all of these things you see on this slide at all of our schools is a challenge that we experience. And making sure that, for instance, check-in, check-out is implemented with fidelity in all the schools that are using it. There are some very specific evidence-based practices that go along with check-in, check-out. Same thing for when you're addressing executive functioning skills, making sure that you're teaching executive functioning skills that have been found to be useful for students. And then certainly another thing that we have had many discussions about in our district is we would like to add to this list. We would certainly like to bring in more Tier 2 interventions that are evidence-based and implement them with fidelity across all of our schools. And certainly picking out the interventions that match the needs that are identified in that particular building. So those are some of the challenges that we have experienced with the targeted interventions. As we move into the top tier, often referred to as individualized interventions, some of the things that are listed across the top here are probably very familiar to many people on this call, because this is actually something that we probably do quite well. We certainly all engage in individualized counseling, and I list the individuals who partake in that. We certainly have students who benefit from a functional behavior assessment behavior intervention plan, students with IEPs, students with 504s, or general education students. We, like all of you, have procedures that we have put in place when there's a student who makes a statement of self-harm, or they make a statement of harm towards others. We offer home and hospital instruction. And we certainly want to continue to collaborate with our community providers, including our school-based mental health services, which I'll talk about in just a moment. Some things that we added in our individualized interventions category during COVID is we added very targeted and specific check-ins with students of concern. You might remember a couple slides ago, I talked about our look-fors, where we're looking for students who we identified with hardships. Members of the student support team are partnering up with students and doing check-ins with those students. Now, last year, of course, a lot of those check-ins were happening and with the parents as well, because the student and the parent were in the same place. This year, we're continuing to offer check-ins with our students of concern. But of course, we'll see the student during this in the school building. We may have to call the parents separately. We certainly are also offering many of the services that are listed on the top half of this slide using a telehealth model during the pandemic timeframe. And like St. Mary's County, Howard County has a digital education center for students who are participating in virtual instruction the entire school year. And so those students would continue to receive these services that are listed here in a virtual fashion. Now, some of our challenges that we've had pre-pandemic as well as continuing through the pandemic are that we would like to strengthen our team's understanding and implementation of the threat management procedures. That has been, for those of you on the call that I know, that's been a particular personal passion of mine, to try and have consistent teams in all of our schools and to have schools implementing the procedures with fidelity. As many of you have been doing, another thing that we continue to expand on is expanding the community providers that we have collaborations with. Now, related to that, whoops, on our next slide, we'll talk just very briefly about our school-based mental health services program. You do see some collaboration with some partners listed on this slide. We are currently have programs in 30 of our schools, meaning that we have a community agency who responded to an RFP that is providing clinical services in 30 of our schools. We were fortunate enough this year to expand, and we now have 6 more social workers. So our goal is by the end of this school year that we're going to expand this program to 50 of our schools. We have 77 schools all total. So we're hoping to expand to 50 by the end of the year. And as a matter of fact, our RFP was just released last week to help support this expansion. So this is, of course, the program where community agencies provide licensed clinicians, whether that's a licensed social worker, a licensed professional counselor, who come into the school during the school day and provide mental health services during the school day for students that have been identified by our SST team. So that brings me to the end of what I had prepared today, but certainly I'm willing to take any questions. Next slide will be my contact information. If you want any more details, certainly feel free to outreach to me as well.
Dr. Schulmeyer, thank you so very much. Any questions or comments or discussion about anything that Dr. Schulmeyer presented or discussed? Samantha.
Yes, hi. Just a really quick question. I know that you said that you find that you reach out to the parents when there are issues with the child. How do you handle it when the parents are also having issues and are the basis of the issues for the children?
Yeah, sure. Thank you for your question, Samantha. You know, certainly in this time of this pandemic, a big lesson I think we've all learned is that it's important to work collaboratively with the families as well as with our students. So if a family informs us that they have some concerns that need to address, the SST team has worked very diligently to try and connect family to local resources. So for instance, if they are in need of support for paying their rent or their mortgage, then I'm going to help refer them to the housing department of our county government, because they of course have been receiving funding during this time of COVID to help support families. Very similarly, earlier in the pandemic, I think all of us experienced the need for families who needed more food assistance. And so whatever services were available in your community to provide food assistance, there was also, the school system was one of those, but there were many other community agencies offering food assistance. I think, you know, that would be another example. So we would want to utilize our community resources to help us in supporting the family.
Thank you.
Dawn.
Hi, I just have a quick question. I know both of you touched upon staff wellness as well. And I was wondering, aside from sharing the resources for staff, are there things that are done on a routine and recurring basis for staff as, you know, as part of regular programming? Is that something that's being added or it has already been standard for your staff members with in-service days, et cetera, for their own health and well-being?
I'm going to answer that on behalf of Howard County in 2 parts. So last year, when we were primarily virtual and staff were virtual, certainly up until the approximate March timeframe, a lot of that was built into our Wednesday professional learning opportunities that we had available with our the way the calendar was structured. Fast forward to this year, that Wednesday opportunity no longer exists. And so really at this point in time, that's all having to be done at the school-based level, and it's having to be done by school administration. Now, certainly our group will provide them with resources, materials, and things to make that happen, so they're not having to start from scratch. But there's not the same opportunities for professional learning right now that there were last year.
Gotcha. Okay. Thank you.
I think for just speaking for St. Mary's on that question, like Cynthia said, during COVID, we had lots of time built in because of that extra day during hybrid. So we could really do some, during that time, we planned like self-care into that day. So we actually built that as part of our professional learning, that they could do these, like we did some yoga, we did some other learning. It wasn't a time to learn about what to do. It was, okay, here's the 30 minutes, let's do it. And we offered that to people that wanted to do that. Now that we're back in school full time with kids in the building 5 days a week, with meetings, you know, lots of times meetings take up teacher planning time. So really, there really isn't a lot of time, but schools are trying hard to build in self-care for teachers as best they can. A lot of times that's, you know, here's some breakfast or you know, it stems around food quite often because that's just what we can do. We offer a lot to our staff, but I'll be honest, this is an area that is close to my heart that we need to support. And it's not just teachers. Like it is, I see it with administrators and the principals of the building. You know, they have a lot on their plates right now, all the way up through our school board members and our upper administration. Like everyone is going to need that time and that self-care. And finding how to support them is a challenge right now. And it's an area that we need to focus on.
And I raise that just because I know, you know, certainly when I say staff, I mean all the many people who make all the many things happen for the kids, right? For the kids and their families. And that certainly it has been a go without a break, no hitting the brakes since school started and everyone's returned. And like any situation with caregivers, the caregivers and the ones who are giving often are neglecting their own needs during that time. And so, you know, I was trying to sort of see what folks are thinking about how best to ensure that there's some built-in time for the staff and all the people who make the things happen for the kids to be able to hit their own reset button and have their own needs met.
Yeah. And Dawn, I think that like our school-based folks are getting some of that. I really do believe that. I think our principals and assistant principals are doing a great job of trying to incorporate that for our staff. For me, I want to see that for our administrators, those principals, our upper administration, our directors, our supervisors. And we are working on that. We do a good job of that. But, you know, I think it's just recognizing people too, when they're doing good things. There's a lot of hostility in the world right now around education and decisions that get made, whether we have any control over those decisions or not. You know, whatever the answer is, somebody's going to hate you for the answer. And that's a lot on a person. And so, you know, I try to bring that up at our meetings to just make sure that we are thinking about our administrators too and supporting them as well. And I think we're working on that. I mean, we are doing it. I think that as with everything, we need to always do more. We do. We need to support them better.
Dawn, thank you for the question. Robin, thank you as well. And Cynthia, it is an issue that all the superintendents are talking about, of course, supporting our students, but also supporting our staffs. From all across, whether it's our food service workers who literally have been out on the curb since the beginning of the pandemic and delivering meals, and now full in-person learning, to our amazing custodians, to our administrators and teachers. It's just so difficult, as Robin points out, to find the time during the day because our days are structured around children. 6.5 hours a day we're structured around caring for children, and it's just so difficult to find that time that we can find some of that time for collaborative and self-care for the adults that are caring for the students. But it is something that we need to continue to focus on. Thank you. Pam, you've patiently had your hand up.
Good morning. I just had a quick question for the data that's being used for both. How often is that data collected, and in the past, but how often will it be collected now, especially since we don't have that one piece of the week that could help with it. So how often will that data be drawn now?
I can speak for our data collection. So our school-based teams schedule in meetings to review that data. Each school does that at different times. So it might be monthly, it might be weekly, it might be every other week, depending on that individual school. At the district level, we build in we meet twice a month, and one of those sessions, we focus on the data. For the other data collection, I collect all the CPS data, the risk assessment data, the threat assessment data. That is a continuous process of collection. As they come in, I'm adding that collection. The social work team data is gathered quarterly. I do quarterly reports on that data and submit them to our community partners in association with that.
In Howard County, it's going to be very similar to what Robin just described. It depends on the data point as to the frequency of its availability and how it will be collected. But the most important data review and analysis happens at the school-based level, because they're talking about their students and what their students need. So, but very similar. It's not a consistent schedule.
Seeing no other hands, thank you so much, both Robin and Dr. Schulmeyer. Cynthia, if you don't mind sharing your slides as well with Kate and the team, so we can get those out to everyone, that would be fabulous. Both of you, thank you so much for taking time to meet with us and help us carry this important conversation.
Thank you so much for having us.
Yeah, thank you very much.
Have a great day.
Thank you again. You do the same. Okay, we'll talk a little bit about sub-cabinet requests as we continue to plan our work moving forward, recognizing that we are an advisory to the sub-cabinet. So we always want to keep a finger on their pulse to see where we can best assist them.
Yes, and as everyone should know, we have a couple of new members of the sub-cabinet, not just the advisory board, but also the sub-cabinet. So in their August meeting, they requested that the advisory board get together and talk about things that either individual departments or agencies might be able to do, including ourselves, whether it's guidance or reports, and we're going to go through some of those examples of sort of what they're looking for. I think that last spring you all requested the presentations by the mental health service coordinators, and I think it's a great tie-in to this request from the sub-cabinet, because there are still needs at the local level. Whether that's the public school systems or individual private and non-public schools, the needs still exist. So there's a lot of money flowing, but are there other resources that might be available that are free, or at least within the capacity of whether it's the center or the sub-cabinet? But we'll get into that in just a minute. So the sub-cabinet has asked the advisory board to identify gaps and opportunities in school safety and make recommendations on how best to address those gaps, and most importantly, measure their success. So I think this will be a common theme that you'll see throughout the requests coming from the sub-cabinet. It's not just let's implement this program or initiative, but what data do we need to collect to determine if that is actually doing what we hope it to do? Are things getting better? So we built out a roadmap over the next year. So the first part's going to be addressing what the needs are and where the gaps are. And this is where it's going to be really important within each of your lenses of school safety, to really think about what you see as the gaps and the needs. The second will be to establish priorities. In other words, of all of these things that have to get done, we obviously can't do everything at once. So what are the priorities that these things need to be done in? And then the last thing ties into the data is quantifying those outcomes. So what does that actually look like? And if you have questions, feel free to jump in while I'm speaking. So this is sort of the timeline for the school year. So today in this meeting, we're talking about sort of the requests from the SubCabinet. What is it they're looking to achieve, or what is it you are recommending that they take action on? In November, we're going to actually really dig into those gaps and those recommendations. So what are the needs? What are the areas that we can support? And again, the SubCabinet has Department of Education, Department of Health, Department of State Police, Department of Disabilities, the Interagency Commission on Public School Construction, the Attorney General's Office. So they're they're also a diverse group of state level stakeholders. December, we're going to dig into the recommendations that you all developed. So throughout each of these meetings, we'll, our team will be supporting you in sort of coming up with the ideas, but we're going to take on the ownership of actually putting the material together for you to actually look at and react to. Then in February, there's no meeting in January. We will set priorities. So you all will decide of the recommended actions, what you think the priorities are for getting those taken care of. In March, we'll talk about how we can quantify those outcomes. We're going to do that through the process. So as we come up with recommendations, we'll think about data points. What does success look like? But in March, we'll really sort of refine that. Come April, we're going to refine following legislative session if there's any major changes, because if there are changes throughout the legislative session, that may require us to shift some of the recommendations or modify some of those recommendations. So we'll do that in April. And then in May, we'll finalize your recommendations so that the SubCabinet can review them over the summer. Any questions on the timeline? There we go. So what we're going to be asking you to do is to look at school safety through your lens, what is important to you, and then think about how we ensure we're covering all the bases across school safety, right? So whether that is physical safety, mental health and well-being, and how do we really bring it all together? Because when the center started and when the legislation passed in 2018, there were a lot of deadlines very quickly, right? For the school systems, for the center, for the SubCabinet, for the advisory board, a lot of things rolled out very quickly. Well, now we have an opportunity to sort of step back and say, okay, we've implemented all of these things. We've collected some of these data points. What else do we need to do? Or what information can we glean from that to make improvements in school safety? So gaps and needs, they could be anything from regulations. Again, the SubCabinet has several regulatory authorities in addition to their own. So the SubCabinet has the ability to promulgate regulations. The members of the SubCabinet also have that ability within their independent departments. Are there more policies? So the behavioral threat assessment policy that was put out in 2018, are there other policies that might be beneficial or useful? Are there guidelines or templates? Are there additional trainings? We're doing a huge revamp of our school resource officer and security employee training over the last 6 months, so that by next summer, we're going to be taking what was a 40-hour training course and making it an 80-hour training course to include a lot more content to hopefully, support our school resource officers and support our school security employees. Are there new reports? Are there revisions to any of the documents? And actually, one revision was specifically requested by the SubCabinet that we're going to be working on So we will be bringing to the advisory board an updated draft of the model behavioral threat assessment policy that was published in 2018. So we're going through that now. We're looking at it from both the legal side as well as the subject matter expert side. So we're going to be bringing to you all over the next couple of months an updated version of that policy. And assuming your approval with that, it'll then go to the subcabinet for finalization. So those are sort of the goalposts that we're trying to get to over the next school year. So I'll open it up to any questions that you all have. Oops. Specific to that, or if you have any thoughts in preparation for November's meeting, and I'll switch back here, where we're going to start to identify those gaps. Are there things that we can do to help you prepare for that November meeting? Those could be, you know, individual interviews, they could be surveys, whatever you think would be useful to you as an individual as part of the advisory board to prepare for gap identification. Dr. Arlotto?
Yes, ma'am. Thank you, Kate. I was thinking, and I'm thinking through the lens of the group that I represent, which are the superintendents, of course, that my next step to prepare for November would be that I'm going to put something out to all the superintendents and ask for their input in a number of these areas. What is it that they want to see either the advisory board or the subcabinet address over the next year? Issues of concern regarding student safety and school safety. That said, does it make sense that maybe we work to create, maybe you and your team work to create sort of a template that all of us can push out to or have conversations with those that we represent, so we're collecting similar information for a discussion, a more in-depth and focused discussion in November?
Yeah, absolutely. I think that's a great idea. So we can certainly put together something for you all to share so that we're all, as you said, gathering the same information in the same manner from your groups. So yes, we can do that.
That would be very helpful. Thank you so much.
Sure. I think I see Karen.
Oh, you're still on mute, Karen.
Karen, your microphone's going, it looks like, but we're not hearing you. No.
I was gonna say I'm doing my best to read your lips, but maybe what you're saying is you're gonna send it to us later or put it in the chat, and then we can do the thing you put in the chat.
Kate, I see that Megan has her hand up.
Yes, Megan.
Hi, thanks. Yeah, I think the survey is a great idea. And I would just try to get the youth and the students input as well in terms of sort of what they're identifying as the biggest safety concerns. Maybe Claire can help us with that. And I'm trying to think just getting it out to sort of, you know, as broad and diverse a group of students as possible.
Yep. Yes, we can do that. And Claire?
To add on to what she was saying, I think it would be really beneficial to push that out through the student focus group as well. We have a lot of eager students on that group this year that would be more than willing to provide their perspective to me and to also to disperse it to students within their own county. So I think that would be really nice, and we'd be able to get a lot of student perspective that way as well.
Let's see, Karen, did you get your mic working yet? All right, I don't see any other questions, and Karen, we can talk offline after the meeting. But if you all have specific questions that you would want to make sure is asked, especially Claire, if you have, specific questions you want asked of the students, because that may differ from what we put together for administration, as well as other folks. So, and certainly our parents, I'm a parent of 2 teenagers, but I think the parent perspective is also going to be important. So we'll look to sort of tailor questions, and then you all can decide you want to send all the questions, but if some of them are not relevant for your group, we can do that.
Just Kate, in the chat, Karen and Lee both included some information regarding wanting to know about the status of the memorandums of understandings between the school systems and the law enforcement agencies providing school resource officers, including the duties of the SROs. And I'm guessing based on the way you phrase that, you're looking to see what the variability is in the duties of SROs between different school systems, or whether they vary within an individual school system based on which agency they have the MOU with. And that seems like what Lee is also asking, identifying the different roles of the SRO across counties and schools.
Okay, we can certainly do that. And we have some of that data already. So we already have this year's school resource officer counts. So that report was submitted, so it'll be posted to our website within the next week or so. Yes, Lee, I see sorry, I'm reading chat, I apologize. Lee, I see your comment regarding some template questions that you can ask for the non-public special education schools. So I may talk to you offline, or we may talk to you offline about that, just because I want to make sure we identify the right questions to ask. Okay. Did I miss Delegate Ebersol? Did you
you didn't
question?
miss me. I just popped my hand up at the last second there. This isn't exactly on your list, but I think it's school safety. I think we need to look into it. If you're following, my teacher friends are telling me that social media, particularly TikTok, is beginning to suggest mass negative actions at schools across the country. And they're going as far as, for example, well, some of them I don't really want to talk about, but one of them is you should bump into or hit a teacher by accident. And so this begins to cross into a dangerous area, I think. And so I don't know where we put that in the group of things that you had up just below the timeline or just after the timeline there. But it's certainly a school safety issue, and I think we need to see if we can find a way to address it. And that's a big order.
Yeah, and that is, our one of our members of our team put together some material related to that for the public schools, as well as our private and non-public partners on that, because it is definitely a concern, and we are seeing it across the nation, not just in Maryland.
All right, thank you so much, Kate. Thank you, everybody. So we will we'll look forward to collecting some more information from the various groups that we represent, and look forward to bring that information to our November 1 meeting, which is the next time we'll get together and discuss some of these issues, both for us as an advisory and making suggestions for work of the subcabinet. So thank you, Kate, and your team for putting some things together that we can push out to our representative groups. All right. That brings us to the end of our agenda. Is there anything for the good of the order that anybody would like to mention or talk about? And I'll look for hands. Seeing none and hearing none, thank you all for as always, your time and energies on these important topics. Can I have a motion to adjourn?
So moved. Eric Ebersol.
Thank you, Delegate Ebersol. And a second?
I'll second.
Thank you, Nick. Any discussion on our adjournment? Hearing none, all those in favor of adjourning, please raise your hand. Those that would like to continue the meeting, please raise your hand. Seeing none, thank you all very much. Thank you to Kate and your team, Dawn as well. And we'll look forward to seeing everybody on the 1st of November. Take care, all. Be safe. Thank you.
Thank you.
Thank you.
Okay, just 4 of us on now. Hi.
Yep. The live stream logo is still up in the corner, so I was hanging on just to make sure that got.
Hold on. Let me stop the live stream.